Good morning everyone, my name is Vicky Wong Lee Fong. Today I will be presenting my mini project for Optics 2. The title of my project is Apply Optics Principle with Calculation. Optics play a fundamental role in optometry, as it is provide the scientific foundation for understanding how visual instruments, contact lenses, and diagnostic tools function. In this project, I focus on the applied principle of mirror, lenses, and prism, which are crucial for assessing, correcting, and enhancing vision. The aim is to connect theoretical optics, which is clinical and instrumental relevant in the field of optometry. In this section, I analyze how mirror form image using the mirror equation, which is 1 over f equal 1 over u plus 1 over v, where f is the focal length, u is the object distance, and v is the image distance. For example, I use a concave mirror with a focal length of 50 centimeters. If the object is placed 30 centimeters in front of the mirror, we can calculate the image distance and magnification using the formulas as shown. The ray diagram illustrated how the image is formed. In this case, the image is real, inverted, and smaller than the object. This type of analysis helps us understand how optical devices, like the ophthalmoscope, manipulate light to the form using image. The ophthalmoscope is a perfect example of applied mirror optics in clinical practice. It uses a concave mirror to direct light into the patient's eyes and illuminate the retina. The mirror reflects light through a small hole so that the examiner can look directly through the pupil and observe the internal eye structures. This allows us to inspect the fundus, detect retina abnormalities, and assess the optic disc and blood vessel. Therefore, understanding mirror behavior is essential for operating and interpreting results from instruments like the ophthalmoscope. Okay, next we move on to the lens calculation. In this example, we are designing a biconvex lens of a hyperopic patient, where both surfaces have a radius of curvature of 20 cm. Given the refractive index of 1.523 for cloud glass, we can calculate the focal length using the lens marker formula. By substituting the given value, we obtain a focal length of approximately 19.12 cm. The calculated power of the lens is 5.25 diopter, which is suitable for moderate hyperopia correction. This example shows how theoretical formulas are used to design optical lenses for practical applies. Let's talk about the characteristics of the lens. The lens design here is a converging lens with a focal length of 19.12 cm and a power of 5.25 diopter. Clinically, the lens marker formula helps optometrists determine the appropriate curvature and refractive index for corrective lenses. For example, understanding how focal length related to the refractive power allows practitioners to select material for trial lens, contact lenses, and intraocular lenses. In this case, the biconvex design ensures balances optical power distribution and reduce spherical aberration, providing clear and comfortable vision for the patient. Now we have the prism application. A prism with an apex angle of 16 degrees and a refractive index of 1.52 is used to measure the angle of deviation. By applying Snell's law and performing the step-by-step calculation, we find the angle of deviation to be approximately 39.23 degrees. This example demonstrates how prism bend light by reflection and how the deviation depends on both the apex angle and refractive index. In optometry, this concept is important for understanding how prism redirect light to correct binocular vision problem. Okay, from the calculation, the prism produces an angle of deviation of 39.23 degrees, directing the light toward the base of the prism. Prism can also be measured in prism diopter, which describe their clinical strength. Clinically, prisms are essential in managing binocular vision disorder such as strabismus and heterophobia. In prism bar test, different prism powers are used to evaluate and balance ocular alignment. In spectacles, prism can be prescribed as relieving prism to easy eye strain and improve visual comfort by ensuring proper alignment of visual axis. Prism play a key role in maintaining binocular vision and depth perception. In conclusion, this project shows that mirrors, lenses, and the prism are not just theoretical optical tools, but have practical and clinical application in optometry. Through accurate mathematical calculation and experimental understanding, we can relate optics theory direct to real-world eye care. And optometrist knowledge in applied optics support the design and use of instruments for relation, magnification, illumination, and light deviation, all of which contribute to modern clinical practice and improve patient outcome. Thanks for watching.